Hi, have you ever considered being a blood donor? Would you like to know the risks, benefits, and overall process of blood donation? If so, listen up. In this video, we will be explaining just that and more in each of the different types of blood donation. Didn't know that there's more than one type of blood donation? Stay tuned to learn more about whole blood, plasma, platelets, and double red cell donations. First, I'm going to talk about one of the most common blood donations, whole blood. It is usually what people think of when they think of donating blood. Whole blood contains red blood cells, white blood cells, platelets suspended in plasma. The red blood cells are the most recognized component of whole blood. It's widely used to treat anemia. It's used in trauma and surgeries quite often. Actually, 1 in every 7 patients entering the hospital needs a blood transfusion. Actually, more than 15 million pints of blood are transfused in the U.S. every single year. I know this firsthand, as my son had open heart surgery when he was just 9 years old. My family and I donated blood in case he needed it with his surgery. What we did is called directed donations, where a family can donate blood or whatever is needed, and they save it for a specific patient. But the most common blood donations are volunteer donations, which goes to anyone that needs that blood. Whole blood donations only last for 21 to 48 days, so new donations are needed at all times. Did you know you can donate blood every 8 weeks? And especially if you have type O negative blood, you're especially needed for whole blood donations, as everyone can use your type of blood, no matter what their blood type is. Just 1 pint of your blood can help save 3 people's lives. Being that I have donated myself, I know the process is safe and simple. Actually, it only takes about 1 hour from when you get to the donation site to when you leave. It's as simple as you register when you get there. They do a quick health history, a mini physical. The donation itself actually only takes 8 to 10 minutes, so it's really quick and easy. Then they'll even give you a snack when you're done. Just think, giving up 1 hour of your day could save somebody's life. Maybe even someone in your own families.
Next, I'm going to talk to you about the process of plasma donation. Blood is composed of about 55% plasma. What is plasma, you may ask? Plasma is a fluid composed of about 92% water, 7% vital proteins such as albumin, gamma globulin, and other clotting factors, and 1% minerals, salts, sugars, fats, hormones, and vitamins. Plasma transports all of these proteins and nutrients to the parts of the body that need it. Plasma products are used by burn, trauma, and cancer patients. Donating plasma is done similarly to how whole blood is donated. Blood is drawn through one arm and channeled through sterile tubing into an automated machine. This machine then separates the plasma from your blood by spinning the blood around at a high speed. This machine may also be called a centrifuge. This causes the different substances to separate and is a process called plasmapheresis. After the plasma is separated, the filtered blood is sent back into the tubing with normal saline and returned to the body. The average plasma donation takes 1 hour and 15 minutes, and there are about 450 certified plasma donation centers within the US and Europe. Not only are you helping to save lives when donating plasma, but sometimes you can even get paid for it. All you need to donate is your ID, social security card, proof of address, and after you answer a series of questions, get a mini physical, and get your finger pricked for blood protein levels, you will be able to donate. How much plasma you are able to donate is based upon your weight at the current time. Plasma donation is a fairly safe process, however, there are some risks. These risks will be explained to you before you donate, but the normal, most common side effects or risks are dehydration or possible infiltration of the IV site. I have donated plasma several times through a donation center called CSL Plasma. The first time I went, it took about 3 hours to get signed up, have my physical performed, and donate. At this facility, I could donate 2 times a week within 48 hours of each other, and based on my weight, I could make up to $250 a month doing so. My experience of plasma donation went very well, and I encourage you to donate in order to help those in need.
Now that you have learned about 2 of the 4 different types of blood donations, I will now talk to you about the third, platelets. Before we discuss the donation process, let's first take a look at what platelets are. Platelets are a blood cell that help control bleeding. When a blood vessel is damaged, platelets collect at the site of the injury and temporarily repair the tear, so it does not bleed as much. Now that you have a general idea of what platelets are, we can now talk about the donation process. During a platelet donation, a small portion of your blood is drawn from your arm, about 1/4 of a pint at a time. The blood is then passed through a cell separating machine. The machine collects the platelets and safely returns the remaining blood components back into your body. This process usually takes about 1.5 to 2.5 hours. Platelets can be only stored for 5 days, so the need for platelet donations is vast and very continuous. You are able to donate platelets once every 7 days. When you go in to donate, make sure that you have a good meal and drink plenty of fluids before donating. This will keep your body hydrated and ready to donate. Many life-saving medical treatments require platelet transfusions, such as cancer patients, those receiving organ and bone marrow transplants, victims of traumatic injuries, and patients undergoing open heart surgery all require platelet transfusions to survive. When my great-grandmother was 97 years old, she was diagnosed with a bone marrow cancer called myopathy syndrome. She had to have a platelet transfusion every 3 days. Thanks to the many different people who donated their platelets, she was able to live longer than the doctors had expected. So why not give it a try? Go in and donate some blood and save someone's life. It only takes a couple hours. Save a life today.
Last but not least, I will be sharing with you about donating red blood cells. Red blood cells deliver oxygen, which is vital to all patients, but especially vital to patients with severe blood loss or sickle cell anemia. Red blood cells are the most frequently used blood component and are needed by almost every type of patient requiring a transfusion. Earlier in the video, we talked about whole blood cell donation, which is the donation of red blood cells, plasma, and platelets, which are all the components of blood. Double red cell is a new donor program that allows you to give enough red blood cells for 2 transfusions in one single visit. This process is called apheresis. The apheresis process allows for collection of only red blood cells while safely returning platelets and plasma back to you. Platelets and plasma are the liquid portion of your blood. The requirements to donate are the same as for whole blood donation. However, apheresis red cell donors must be type O, type A negative, or type B negative, and must meet the minimum requirements for blood volume, which is determined by your height, weight, and hematocrit, which are your blood iron levels. Blood is collected through sterile tubing from one arm to the machine. The machine collects and separates 2 units of red blood cells and returns the remaining plasma and platelets to you with some saline. With red blood cell donation, not only are you saving time, because the procedure lets you donate more product, but you may feel better after donating. This is because the plasma and platelets, which are the liquid portion of your blood, have been returned back to you, which is causing you to feel more hydrated. You can donate red blood cells every 16 weeks in comparison to every 8 weeks with whole blood. You also must wait 16 weeks from your red blood cell donation to donate plasma or platelets as well. Why not try double red cell donation today and have a twice as rewarding experience? Now that we have shared with you some information on all the ways you can donate whole blood, plasma, platelet, and double red cell, you have the opportunity to help save someone's life just by taking the next step. Contact your local blood donation center or look online at redcross.org to find out more information.